It's not a time for you to begin to tell them it's because they are paying £20,000. That's why. It's because I want to be in the UK. That's why. No, that's not valid enough reason. Hello and welcome once again aboard JulieCity. I'm always excited to be here, and I'm glad you are here. Thank you so much for tuning in to watch today's video. You are highly welcome. I hope you are keeping safe and well. So today I've chosen to discuss something I believe will be useful, especially for those people who have recently joined us or who are interested in the healthcare assistant position in the UK. I've gotten some emails and I've gotten quite a lot of calls making inquiry. How do I go about it? What do I do? How do I construct my CV? What about the interview? What is it going to look like? So I just thought in this video I will kind of list out some key terms or terminologies that are relevant to nursing and healthcare that the person looking through your CV or interview you is looking out for, that will score you high points and get you that job that you are looking for. If it's something you're interested in, then stay tuned and keep on watching. So in nursing, we have what we call the 6 C's of nursing. And you might say, no, I'm talking about the care assistant work, but you are basically an auxiliary nurse, a nursing assistant. Yeah, in some areas they call the care assistant a nursing assistant. So if you're a nursing assistant, there are things you need to know in nursing that will be useful to your practice. And these are some of the essential keywords or key components that your interviewer or the person reading through your CV is looking out for. These 6 C's include caring, compassion, competence, communication, courage, and commitment. The other ones I'll be adding will be safeguarding, confidentiality, dignity, and respect. And these are the words I'm going to explain in this video. Hopefully, if you include this in your CV and during your interview, you focus on these terminologies, then you should be in a better place to get your dream job. Now, I'll combine caring and compassion. The building block of nursing is based on caring and compassion. If you take these two out of it, then there's nothing like nursing. So the employer is looking for somebody with loads of caring attitude and that is compassionate. And this you should portray from your CV to the time you're answering your interview questions. Your interviewer is listening and watching out to see those skills, those attitudes, those experiences that portray that you are a caring and a compassionate person. So bear that in mind. The next one I'm going to deal with is competence. If you deem yourself not having experience, then I will want to understand that you're saying this because you've not worked in a formal setting like a hospital, nursing home, residential home, or one of those ones. But I assure you that some of these roles you perform every single day. It's possible, especially in Africa, where we kind of live some form of communal life. You know that you've taken care of your mother, your grandma, your auntie, your younger sibling. Yeah, and by the time you look after them, bathe them, provide food, cook food, go about shopping for them, you're already fulfilling the role. And that's why they are saying you don't necessarily need an experience. All they need is for you to package it properly, use those keywords that they are looking for in your CV and during your interview, and you'll be good to go. So yes, competence is important. The next one will be communication. Communication in nursing or in healthcare cannot be underestimated. There's no way you can't function without communication. Now, we're not just talking about ordinary communication. We are looking at effective communication. In caring, there's no superhero. There's no one person that is a superhero in the caring environment. The care assistant is needed, the nurse is needed, the doctor is needed, the family, the patient, pharmacist, clerk, cleaner, porter, everyone puts hands together to give the best care that we can give to our patients. So just know that when they are talking about communication, they're not just talking about your ability to speak English. That is important. But it also means how you can effectively communicate with every other person that will be involved in that patient's care, including that patient, so that they will get the best care that they can get, and so that you can give the best care possible. The next one is your ability to speak up, and that is the one I call courage. Having the courage to challenge care that you're not comfortable with. So if you observe an abuse or neglect, you have the courage to speak up and not just watch it happen. We want to give best and safe care to our patients. A lot of times in certain settings, like a nursing home, you realize that you might have 40 patients on the unit, and there might be one nurse like in the night or two nurses in the daytime. The rest staff, probably 5, 6, might be carers. So you realize that the carers spend more time with the patients or the residents of that nursing home than the nurse or the doctor. So you will get to see a whole lot of things that the nurse might not be able to observe, or the doctor who comes with once in a while might not be able to observe. So we are counting on you to be able to report back to us so that our patients or residents can get best care. So you should be in a place, you should be courageous enough to speak up for whatever it is, irrespective of who is involved. You follow protocols. So courage is another key word that you add to your CV and bear in mind for your interview. The next one is commitment. Commitment means committed to your work, committed to giving safe care, committed to giving a care that promotes dignity and respect, committed to following guidelines and the policy of the healthcare system or policy of the home or trust that you're working with. The next one is confidentiality. That is a huge thing as well in healthcare. That you have personal information or details or mannerism of a patient does not mean that you just put it in the open for any and every Tom, Dick, and Harry to access. You mind your mouth, where you speak, how you speak. If you're going on the bus, you're not expected to be talking about your patients carelessly. You need to make sure that everything that happens in the room, except for those who are involved in their care, stays there. You document it appropriately. You share it with only those who are significant in the care of that person, and that is it. Going out on the bus, going out for coffee and discussing your patients and how awful they were is a no-no, because you'll be breaking the confidentiality rule. One thing you need to know is that our patients or our clients are not there because they choose to be there. A lot of them are not. They are there because of their vulnerability, their inability to fulfill those regular things that any other person would do normally. So it's actually a privileged position to be able to assist them. I understand sometimes due to their medical conditions or mannerism, they can turn out to be challenging. However, we have to act like the professionals that we are, ensure that they are safe and their dignity is maintained. And that leads me to the next point, which is dignity and respect. Like I said earlier, you need to do to others what you want others to do for you. So if you're going to perform personal care for a client or a patient, then make sure that their dignity is kept by pulling the curtain, shutting the door, and making sure that they don't feel so helpless in the situation that they are. Because we all love to have our private. So think about it that way. Dignity and respect also means that when you're speaking to that patient, that client, yes, they are vulnerable in many ways, but you still need to respect them. If they are non-verbal or they can't speak, then you should be able to interact with them in a way that will not make them even more helpless, but in a way that will make them feel like they are relevant. So bear that in mind, that dignity and respect is crucial. Safeguarding is huge when it comes to care as well. A lot of your patients or clients that you'll be looking after are those who are vulnerable. They are unable to advocate for themselves, speak for themselves, assist themselves, depending on their needs. So it's important that they find someone who is able to promote that. And that's where courage comes in, like I mentioned earlier. Your ability to be able to speak up in the face of neglect or abuse. Your ability to provide care that is seamless, that is high quality, that will not compromise the health of the patient or the client in question. Are you aware of the guidelines and policies regarding safeguarding? Those are the things I would encourage you. If you Google them, you will find them very useful. You will find the act that governs safeguarding, what is allowed, what is not allowed, the do's and the don'ts. If you've not done this and you want to apply for the role, then I will encourage you to go make Dr. Google your friend. Of course, when you come over, you have inductions, you have trainings which will put you through the standard that UK wants. But it's important that I mention this, so while you're preparing your CV and for your interview, you're able to think about these keywords, put them where they are necessary, and all of that. For example, I'll use a simple question that always comes up in an interview like the healthcare assistant interview. It's not a time for you to begin to tell them it's because they are paying £20,000. That's why. It's because I want to be in the UK. That's why. No, that's not valid enough reason. What the interviewer is expecting is for you to show forth your skills and your abilities. It's for you to tell them why and what. This is your time to explain and show that you're a caring, a compassionate, and a competent person who is able to fulfill effectively the healthcare assistant role in a seamless and safe manner. It's also a time for you to show what you can bring to the table, and that includes your commitment, your courage, your communication skills, your ability to provide high standard care, and your ability to provide it in a safe and competent manner. So you see, all of these things that we have discussed, they matter. I hope you found these points and pointers useful. Let me know in the comment section any questions or any clarifications, and if you need me to do a specific CV, I will gladly do so. Just leave your comments in the comment section. And before I go, I will ask, have you subscribed? If you have not, this is the time to do so. Just click on that red subscribe button and the notification bell. That's when you get notifications for all my uploads and you won't miss a thing. Be sure to know that if I hear any updates or if I find anything that is useful, I will always bring it up on one of the videos or in my community page. Remember, don't keep this video to yourself. Share on your WhatsApp status, share on all your other social media platforms. You never know who you can be helping. Till I see you next time, don't forget, your health is your wealth.